Hello.
Hi.
Today we will be talking to you about how pressure ulcers occur, how they are staged, how wounds heal, and how to perform a sterile dressing change.
As in our DeWitt fourth edition textbook, pressure ulcers are also known as decubitus ulcers, or bed sores that occurs when pressure is put to the skin. They can be caused in many different ways, but the most common way is the mobility of your patient. If a patient is confined to his bed or a chair or some area in the same spot, that puts more pressure on that certain body part. So also, if a patient is independent and can't be mobile, can't move around, it is very important for you to educate your patient on being mobile and also turning your patient and keeping your patient that is immobile and independent to keep them moved and make sure that they're changed at least every hour, every 2 hours, and not on the same side. Another cause of ulcers can be moisture, like if you have a patient that's incontinent, sorry. That means bowel can't contain it. So you make sure that they're changed, that they're dry at all times, not even just changing, but in bathing. Make sure that you get every part dry, every area of the body. Also, proper diet, that is very important in ulcers, because if you are not taking in the proper calories, proteins, fluids, vitamin, or minerals, the body cells begin to break down and get damaged. So it's very important that you keep those proteins and stay as healthy as possible.
Okay, how pressure ulcers are staged. According to the National Pressure Ulcer Advisory Panel, stage 1 is when the area of it's either red, deep pink, or molted skin that does not blanch with fingertip pressure. So if you have a red patch on your skin and you press on it, sometimes it'll turn white and then go back to red. But when a pressure ulcer starts to form, it does not. Stage 2 is partial thickness skin loss that looks like either a blister or a shallow crater. Stage 3 is full thickness skin loss that looks like a deep crater. Subcutaneous tissue is damaged and bacterial infection is more common. Stage 4 is full thickness skin loss with extensive tissue damage. Infection is usually widespread and it may appear dry and black, or it could be wet and oozing. And unstageable is loss of full thickness of tissue. It may appear tan, brown, or black on the inside of the wound. It can also appear either yellow, gray, green, or brown. And the last stage is suspected tissue injury. Localized discolored intact skin that is either a maroon or purple or a blood-filled blister resulting from damage to underlying tissue from pressure or shearing. It may be painful, firm, mushy, boggy, or warm.
Okay, the stages of healing. The first stage is inflammation. It's a localized response to injury, and it begins immediately upon injury. This stage includes constrictions of the blood vessels, platelet aggregation, which is clumping, formation of fibrin, and from the action of the thrombin and fibrin, and epithelial cell migration. A scab forms to protect the wound against pathogens. The epithelial cells migrate to the wound, and within 48 hours, there's a layer of epithelial tissue that forms over the wound. Chemicals reaction released from histamine and prostaglandin occur. Small vessels dilate and become more permeable. This allows serous fluid, serous as in S-E-R-O-U-S, not serious as let's get serious about this, to go into the traumatized area. This collection of plasma and fluid coming in causes edema, swelling in the traumatized area. The more chemical reactions bring neutrophils, which are phagocyte cells. They eat, phago meaning eating, and they eat debris and bacteria that are invading the area. The clinical signs of inflammation are swelling or edema of the injured part, erythema, which is redness resulting from the increased blood at the site, heat or increased temperature at the site, pain from pressure on the nerves, and a possible loss of function resulting from the changes that are occurring. Stage 2 is proliferation. It begins about the 3rd or 4th day and it lasts 2 to 3 weeks. Macrophages, phagocytic cells, continue to clean the debris and stimulate fibroblasts, which synthesize collagen. Collagen is the main fiber structure, protein structure of tissue. Newly constructed capillaries networks provide nutrition and oxygen, and this all synthesizes the growth of granulation tissue. Full thickness wounds closes by contraction as new tissue grows. Scarring depends on the area of the stress or the wound, and in 15-20 days, the risk of it reopening is minimal. Maturation is the last stage, and it starts about the 3rd week. Collagen lysis, which means it breaks and ruptures, and collagen synthesis, which means it builds up. It's a give and take, constant breakdown, constant build up. That forms the scar, and that helps to make the scar strong by doing so. The scar slowly thins and becomes pale, and the end is a firm, unelastic scar. Scar tissue is not elastic. It's not stretchy like your regular skin. If you're going to do a dressing change, a sterile dressing change on a wound, you want to first perform hand hygiene. You want to wash your hands. Then you're going to prepare your workspace. You're going to open the packages, touching only the outside as you lay your workspace out. The inside is sterile, okay? You want to prepare your wetting solution. You're going to take your solution, you're going to remove the cap. If it's already been opened, you're going to do what we call lipping it. You're going to pour a little out, and then you're going to pour it in your sterile container, waiting to receive the solution, okay? You're going to don clean gloves. You're going to go to your patient, and you're going to slowly remove the old bandage, taking the tape toward the center of the wound, and then you're going to remove the bandage. You're going to throw the bandage away, and you're going to discard the gloves, okay? You're going to, if you have sterile alcohol or the sanitizer, you can do hand hygiene again, but never look away from your sterile field. You're going to don your sterile gloves. You're going to then, with your sterile gloves, work in your sterile field. If it's a wet to dry, you're going to need to put some of those gauze in the wet solution. Okay, then you're going to need to take your irrigation and irrigate the wound. You're going to take, there's usually comes with swabs to go in there and with iodine or antiseptic, and you're going to clean out the wounds. You're going to swipe down, discard, swipe down, discard. Don't use that again over and over in the wounds. Then you're going to place the needed wet dressings. You're going to wring them out a little, and you're going to place them in the wound. Careful not to touch the wound, just poke the dressings in. Then damp, then your dry, sterile dressing. Then once that dry sterile's on there, you can remove your gloves, tape the edges so that it's sealed all the way around. Bugs can't crawl in there and get in the wound. You're going to write and date, and then you're going to discard all your waste materials. You're going to make sure your patient is comfortable, redo the room, and leave. So that is our instruction on wounds, the stages of the pressure sores, how to clean it, and how a wound heals.
Thank you.